Thank you, Ted. And good morning to everyone, to my colleagues in the cabinet, and of course everyone here. This is like a who's who for Philippine healthcare. Well, I might begin by just saying that I was really listening intently to Secretary Dury's presentation, and I would agree straight away that this administration had huge gains, really huge gains. During my time, we were a flat 10 billion pesos for the DOH budget for 4 years, almost five. Now the budget going to 2016 is 120. But those gains actually were built up also through the administration of Picoy Duque. Okay? And if you hark back to national government providing money for PhilHealth, Gloria Macapagal-Arroyo put 3 billion in 2004. So my role today, and I don't want to speak very long, is essentially to nuance the successes and gaps of the gains of this administration with data that we collected over several months. And so this presentation is really a composite of a process where we looked at 100+ studies researched over the last 5 years, commissioned by the Department of Health and the Philippine Council for Health Research and Development. All those 100 studies, we selected about 40 that went to a process in what we call the Newton Fund Workshop, where researchers from the UK and the Philippines looked at these 40 cases. That was distilled into 5 presentations that was given in January. And it's now distilled into 1 presentation that I'm giving today. So in a sense, this talk is a reality check. It's a reality check for what we might say is population coverage, meaning to say how many Filipinos are covered by PhilHealth insurance, the services and benefits that PhilHealth provides, and you might say the cost coverage, the protection that it provides. But as I give this talk, I want to remind everyone that we're talking essentially here of the health system, which in the Philippines is 70% private and 30% public. When you think of that public system is devolved. You've got national and you've got local. And in local, you've got provinces and municipalities. And when you talk about private, you're talking about thousands of clinics, thousands of hospitals. And you're trying to say, we want a system that's going to take care of all Filipinos. That's essentially what we're talking about. And so how do you even begin to think about all of that? And this is a definition of universal healthcare, which the whole health system achieves or aims to achieve. But look at that definition. It is layered with 4 or 5 different ideas. One idea, ensure that all people. Ensure, what do you mean by ensure? You can provide services directly, you can provide services indirectly, you can buy services, you can regulate services. What do you mean by ensure? When you say all people, where are the people? Urban, rural, young and old, women, children, working adults. So that idea, ensure that all people obtain health services. That's the second layer. What health services? Preventive services, curative services, personal services, services against cancer, epidemic control services, vaccination services. What do you mean by health services? When they say without suffering financial hardship, What does that mean? If you're rich, if you're poor? As I've reflected on this, I'd say, thank God we have a private system that if you can afford it, you can go to a good hospital and get good health care. But we can tell stories where people are not as lucky. And finally, when paying for them, do you pay for them by paying for insurance? How many people pay insurance? Do you pay for them by paying out of pocket? And so this whole idea, when you think about it, 4 or 5 layer ideas actually telescope into essentially 3 main ideas of this administration, which was financial risk protection, access to quality services, and achievement of the health MDGs. My presentation will try to nuance those 3 ideas, and it will begin with this. The first idea is the idea of population coverage. And the question of this population coverage really has to do with what does this number really mean? This is a modeled figure of PhilHealth. And that modeled figure does not necessarily have the names of every individual in the Philippines. So this does not necessarily mean 88 million Filipinos with their particular names. This is modeled. The figure is actually higher now. We're targeting 95% already. So one can actually say that we are, from the point of view of this administration, in case of population coverage, already enrolled 95%. But that is quite an important achievement. But who are those 95%? This is a slide that tells you who that 95% are. And this slide will tell you those who are covered, but also will tell you those who are paying for the coverage. So who are covered? The figure in blue, 35%, are those that pay for fill-out services because they get it out of their salaries. The informal sector, including even the OFWs. These are the main 2 sectors that pay for fill-out coverage. And when you think of fill-out coverage, how much premiums do you pay? $2,400 from your salaries every month. Every year. Sorry, okay, depending on the salary, but think about it that you have 30-40% of your population trying to pay for the benefits for everyone. Sin taxes have come in and are now covering the indigents. And the rest here, they're all entitled. I'm a senior citizen, I'm already entitled. So when you think now of the system, just in terms of PhilHealth, you ask them, what does the system actually provide? This is a figure that just shows you the benefit packages of PhilHealth. Up here are the PhilHealth packages for inpatient. I hope you can read it. Inpatient here, Z-benefit. These are the actual entitled members, from the formal sector all the way to the informal and so on and so forth. And you can see that this part is the part that's inpatient care. The rest below it, that's primary care. And that's simply, we're still trying to roll that out. But you can see here TB dots, HIV drugs, malaria, and so on and so forth. But the next slide will tell you how are these benefit packages being supported